Hi, my name is Daniela Lisa de Panesanton, and today I will talk about vitamin D supplements and prevention of cancer and cardiovascular disease. Contents, definition, application in medicine, pros and cons, issue in Ecuador, prevention, and conclusion. Definition. Vitamin D is a nutrient found in some food that is needed for health. It is found in cells is important to the body in many other ways as well. In a study of cancer cells and of tumor in mice, vitamin D has been found to have several activities that might slow or prevent the development of cancer, including promoting cellular differentiation, decreasing cancer cell growth, stimulating apoptosis, arousing angiogenesis.
Vitamin D is a fat-soluble vitamin that is essential for the absorption of calcium and phosphorus. Several forms of vitamin D exist, but the most important form is vitamin D3. While there is a lot of research on vitamin D, the most conclusive finding is its benefit to bone health. Deficiencies in vitamin D can lead to weak bones and possible fractures. High levels of vitamin D intake can lead to elevated calcium and phosphorus levels, which can cause nausea, headaches, and calcification, the buildup of calcium salts, of the heart, kidney, lungs, and in the ear, which can lead to deafness. Vitamin D can be produced naturally from sunlight exposure as the UV rays induce the body to manufacture vitamin D from cholesterol. The amount of sunlight needed ranges from about 5 to 20 minutes 2 times per week. The darker the individual skin color, the longer amount of time is needed. The use of sunscreen absorbs or blocks UV rays, which will affect the body's ability to produce vitamin D. Foods rich in vitamin D include oily fish, mushrooms, and dairy products. The recommended amount of vitamin D to be consumed daily is 600 IU, or 15 micrograms. For instance, cooked trout provides 539 IU, and 1/2 cup of portobello mushrooms provides 192 IU, for a total of 731 IU, meeting the daily recommendation. Toxicity thresholds for vitamin D range from 10,000 to 40,000 IU per day. On our vitamin deficiency rating scale, vitamin D is a 4.
Application in medicine. Participants were recruited throughout the United States, and the groups were balanced according to sex and with a goal to include at least 1,000 Black participants. Eligible participants had no history of cancer, except non-melanoma skin cancer or cardiovascular disease at trial entry, and they were required to agree to limit the use of vitamin D from all supplemental sources, including multivitamins, to 800 IU per day and to complete a 3-month placebo run-in phase.
This is from Twitter. Chloe Dutch says, comment on vitamin D and its help in preventing cancer. Michael, take it away.
Yeah, so we know vitamin D is great for the bones. Institute of Medicine actually came out and just tripled their recommendation of how much we should have. But we really don't know about the effects on cancer, heart disease. We have shown some possible increase in those conditions in people who have low levels of vitamin D. At this point, we really don't know. And for instance, the Institute of Medicine really just is not willing to make that
And they had that study come out. But and too much vitamin D is too much.
Yeah,
absolutely. Not good for you, right? So you can get it from your multivitamin supplement, right?
Yeah, and if you just get it from your multivitamin, you're probably not going to get too much, but there are actually supplements on the market that contain more vitamin D than you should actually get in an entire day.
And how many should you have? How many IUs?
They just increased it to the absolute upper is about 3,000, but really you only need about 600 to 800 depending on your age.
But vitamin D really is important because didn't they do a whole study, and maybe I'm crazy, but I just remember this, about that's a separate issue, but about multiple sclerosis being more prominent in dark areas where there's not sunshine, which is one of the biggest sources of vitamin D.
You and I talked about this. So there are these associations. People who have low vitamin D have higher incidence of breast cancer, colon cancer, prostate cancer, maybe even multiple sclerosis. But it's a whole other thing to say that giving vitamin D is going to prevent those. And that's really what we don't know. But seasonal affective disorder kind of makes sense, right? The people who they need the light in order to, get feel better, less depressed, and you give them, and then their vitamin D is low. And I've had some patients, just parenthetically, I give them vitamin D, and they say that their depression gets better. Now, there's a placebo effect that's
Right.
huge. Who knows? But I think it's really important to not do what we always do with these things, is jump on the latest vitamin and say, oh, if 10 milligrams good, 1,000 milligrams.
And
that'd be
sure
even
enough, though,
better.
there's going to be another study that tells you something
Not
else. So I think
right.
probably everything in moderation. And
Including
again, what is the
excess.
highest point of the highest level of vitamin D you should be taking?
I think they actually, I think, increased it to about 3,000, but you don't really, for your regular daily, you don't need nearly that much.
Pros and cons. Among many other benefits, vitamin D plays an important role in the mineralization and growth of bones, increase intestinal absorption of calcium and strengthens the immune system, helping to prevent infection. Its deficiency can cause rickets in children and osteomalacia in adults. But also, according to recent research, an adequate supply of vitamin D to our body could translate into a protective effect on the cardiovascular health of men and prevents the onset of type 2 diabetes.
Growing up, our parents told us to drink lots of milk to build strong bones. However, the amount of vitamin D in milk doesn't come close to what we may actually need. So says Dr. Joanne Manson, Chief of Preventive Medicine at Brigham and Women's Hospital.
It's very difficult from foods alone to have adequate intake of vitamin D. The main sources of vitamin D are sunlight, ultraviolet light exposure, which causes the skin to synthesize vitamin D, and getting dietary intake through supplements or the diet.
The necessary maintenance of skeletal mass is highly dependent upon vitamin D and calcium, and vitamin D is necessary for the intestinal absorption of calcium from the diet.
Dr. Judy Glowacki is director of the Skeletal Biology Research Lab. She teamed up with Dr. Meryl Leboff, director of the Skeletal Health and Osteoporosis Center, for a study on vitamin D and bone health.
1 out of 2 women and 1 out of 4 men age 50 and older will develop an osteoporotic fracture in their remaining lifetime. And we found that 90% of patients admitted to Brigham and Women's Hospital had low levels of vitamin D that were not healthy for their bones.
The doctor's next research study will be to determine how much vitamin D we need to prevent fractures.
What we don't know is what the optimal vitamin D replacement is for adults.
We're hopeful that this will lead to new ways of preventing osteoporosis from even developing in younger people.
Dr. Scott Weiss, director of the Respiratory Division at Channing Lab, has been studying the connection between vitamin D deficiency during pregnancy and children with asthma.
We went on and did 2 birth cohort studies where we demonstrated that pregnant women who had lower intake of vitamin D were much more likely to have children who had asthma and allergies. We're going to enroll 760 pregnant women and randomize them to 2 groups, a treatment arm that's going to get 4,400 IU of vitamin D, and then just regular multivites in the control group. We believe that there's going to be a dramatic reduction in the wheezing rates in the first year of life, and that this will carry over to a reduction in asthma at age 3 to 6.
Finally, could vitamin D be the miracle drug that prevents many different diseases?
It is tremendously exciting to think that something as simple as taking a vitamin D supplement could have these myriad benefits of reducing the risk of cancer, cardiovascular disease, diabetes, autoimmune diseases, improve cognitive function, decrease depression.
However, Dr. Manson says much more research still needs to be done. That's why a clinical trial to test its influence on these diseases, as well as possible side effects, is so important.
There is a feeling that vitamin D may be more promising than many of the other vitamins and minerals that have been tested in isolation as single nutrients within a pill pill form. However, we still should be cautious before jumping on the vitamin D bandwagon.
Use apply in Ecuador. Cancer of various etiologies is common in Ecuador. However, no application of vitamin D has been found for the prevention or treatment of cancer. Doctors use it as a vitamin supplement for bone health, especially in adults with calcium disorders. Prevention. A study published in the American Journal of Clinical Nutrition indicated that men who consume the recommended amount of vitamin D are less likely to suffer from cardiovascular disease than those who have low level of this nutrient. In research conducted in the United States involving 74,272 women and 44,592 men who were followed for 2 decades, it is concluded that men who take at least 600 daily units of vitamin D were 16% less likely to develop cardiovascular disease than men who took less than 100 units.
Vitamin D is known for its role in prevention and treatment of bone health issues as we age. Now, a new study looks to determine taking a high-dose vitamin D supplement could help prevent heart disease as well.
Cleveland Clinic doctors say the results of the study are in line with what others have already shown about dietary supplements and heart health.
This is yet another study that shows that vitamins and dietary supplements have virtually no benefits in preventing heart disease.
Previous research has shown that people with low vitamin D levels have an increased risk for heart disease. Other studies which have sought to determine a benefit in taking vitamin D for heart health used lower doses of the supplement. This latest research tested a very high dose, as high as 200,000 units in the first dose, to a group of more than 5,000 adults between the ages of 50 and 84. After a little more than 3 years, researchers found no benefit for those folks when it came to preventing heart disease. Dr. Nissen says there is no magic bullet supplement when it comes to heart health. He says people are much better off if they work on their overall health habits.
Exercise, eat well, know your numbers, know your cholesterol, know your blood pressure. Make sure you keep your body weight down so you don't get diabetes, and you're way ahead of the game.
Dr. Nissen says people often ask about supplements after reading about them on the internet. He says it's best to make sure that what you're looking at online is based on science, and always consult your doctor before starting any supplement. And if you want to learn more about this, the complete results of the study can be found in JAMA Cardiology.
People are going to have their last.
Conclusion. In summary, daily high-dose vitamin D supplementation for 5 years among initially healthy adults in the United States didn't reduce the incidence of cancer or major cardiovascular events. Therefore, it cannot be recommended as it doesn't pass the clinical trial successfully.
Big headline about health from a study of almost 1 million people. Today, a new report says you can cut your risk of cancer and heart disease by paying closer attention to a vitamin D. Here's ABC's Maros Galvacampo.
It's a spring ritual, getting reacquainted with the sun, and a critical one, too. The major new study of nearly 1 million people finds the lower your vitamin D levels, the higher your risk for certain diseases, including a 35% increased risk of death from heart disease and a 14% increase in death from cancer. Vitamin D not only helps block a host of major illnesses, it can boost your heart and even strengthen your bones. This while an estimated 2/3 of the population isn't getting enough.
So just how do you raise your vitamin D levels? Well, for one thing, spend more time outdoors. Doctors recommend about 1 hour of time in the sun per week, and they say to expose as much skin as possible.
Of course, experts say you have to take precautions not to get too much sun, and they point to the vitamin D you can get by eating more salmon, mushrooms, and fortified dairy. For middle-aged and older women, vitamin D3 supplements can help too.
Food sources are really limited, so it's best for most people to take a supplement.
But this spring, experts say the best thing to do is get outside and soak up some sun.
Now, that 1 hour of recommended sun time can be spread out over the entire week, and doctors say that amount, just a few minutes each day, generally won't increase your risk of skin cancer, Diane, or other problems that come with too much sun exposure.
And again, you can use some protection.
You absolutely can.
All right, Mara, thank you.